1. When developing an orientation program for new neonatal intensive care nurses, which adult learning principle is most critical to incorporate? A. Allowing learners to remain passive observers. B. Providing opportunities for self directed learning. C. Emphasizing rote memorization over application. D. Limiting feedback to the end of the program. 2. In evaluating the effectiveness of a neonatal resuscitation curriculum, which method best measures knowledge transfer? A. A written multiple choice exam only. B. Simulation based performance assessments. C. Observation of nurses during break times. D. Peer self reports without structured tools. 3. A neonatal intensive care nurse mentor notices that a new graduate nurse struggles with thermoregulation protocols. What mentoring technique is most effective? A. Correcting errors immediately without explanation. B. Demonstrating correct practice and then coaching return demonstration. C. Allowing the nurse to figure it out independently for confidence. Sending the nurse to review the policy manual only. 4. When designing a training module on neonatal sepsis protocols, which principle of adult learning ensures engagement? A. Linking content to real clinical cases. B. Presenting abstract theory without examples. C. Using only lecture slides with dense text. D. Avoiding learner input during sessions. 5. A curriculum developer wants to integrate critical thinking into NICU training. Which instructional strategy is most effective? A. Case-based discussion with guided analysis. B. Memorization of infection control policies. C. Passive viewing of instructional videos. D. Reading a textbook chapter silently. 6. Which evaluation method provides the most accurate measure of communication skills in a high-stress neonatal emergency? A. Likert scale self-assessment surveys. B. Role play with structured debriefing. C. Peer ranking lists. D. End of shift paper quiz. 7. A NICU educator aligns her teaching with Knowles's adult learning theory. Which of the following reflects this principle? Adults need immediate application of knowledge. B. Adults learn best through dependency on authority. C. Adults avoid problem-centered learning. D. Adults require minimal context for content. 8. When conducting a peer review for compliance with Joint Commission standards, which evaluation tool is most reliable? A. Informal conversation with colleagues. B. Checklist based on regulatory criteria. C. Anonymous suggestion box responses. D. Personal opinion of the nurse manager. 9. Which strategy is most effective for mentoring a NICU nurse in handling family communication during end-of-life care? A. Modeling conversations followed by reflective discussion. B. Assigning textbook readings on grief communication. C. Allowing the nurse to avoid such conversations until more experienced. D. Reprimanding the nurse if discomfort is observed. 10. A NICU educator needs to update the neonatal medication safety module to meet new state regulations. What is the first step? A. Review current regulatory standards and evidence-based guidelines. B. Collect anecdotal staff feedback only. C. Use last year's curriculum without changes. D. Focus on minimizing program costs. 11. Which adult learning strategy best supports a diverse group of NICU nurses with varying experience levels? A. Offering modular, self-paced online learning units. B. Mandating identical lecture-only sessions for all. C. Providing one-time orientation without follow-up. D. Limiting resources to experienced staff only. 12. During a simulation of neonatal code situations, what evaluation approach ensures validity? A. Performance checklist with standardized scoring. B. Informal comments from observers. C. Nurses' self-reflection only. D. Attendance logs at the simulation. 13. In mentoring new NICU staff, which practice fosters reflective practice? A. Guided journaling after challenging cases. B. Memorizing policies for recitation. C. Avoiding discussions about mistakes. D. Assigning independent reading without feedback. 14. Which communication skill is essential for interdisciplinary NICU team collaboration? A. Closed-loop communication. B. Passive note-taking during rounds. C. Interrupting to assert authority. D. Minimal verbal exchange to reduce noise. 15. In developing NICU orientation curriculum, which outcome measure best reflects success? A. Reduction in adverse neonatal events. B. Number of slides presented in training. C. Hours logged in classroom sessions. D. Staff turnover rate only. 16. A nurse educator uses formative evaluation during a NICU workshop. What does this involve? A. Providing feedback during skill acquisition. B. Conducting a final exam at the end only. C. Measuring annual outcomes retrospectively. D. Relying solely on written course evaluations. 17. Which mentoring approach promotes autonomy among NICU novice nurses? A. Gradually increasing responsibility with guided support. B. Withholding responsibility until full mastery is proven. C. Assigning all critical cases immediately without guidance. D. Avoiding opportunities for independent decision-making. 18. What curriculum development step ensures regulatory compliance in a NICU course on infection prevention? A. Aligning objectives with CDC and state guidelines. B. Using local traditions as the main framework. C. Avoiding updates unless violations occur. D. Delegating content entirely to staff preferences. 19. A nurse preceptor asks a mentee to identify strengths and weaknesses after a shift. Which adult learning principle is applied? A. Self-assessment encourages self-directed learning. B. Dependency on authority is reinforced. C. Abstract theory is prioritized over practice. D. Passive observation is maintained. 20. Which evaluation method is best for long-term NICU skill retention? A. Follow-up simulation drills 6 months post-training. B. Immediate end-of-course exam only. C. Counting CEU credits earned. D. Supervisor anecdotal impressions. 21. Which curriculum design method ensures critical neonatal competencies are covered? A. Backward design aligning objectives, content, and assessments. B. Creating slides before defining learning outcomes. C. Basing curriculum solely on staff suggestions. D. Copying modules from unrelated specialties. 22. A nurse educator identifies gaps in communication during interdisciplinary rounds. Which educational intervention is most effective? A. Implementing structured team huddles with role assignments. B. Posting reminders on a bulletin board. C. Increasing the number of email updates. D. Limiting communication to senior physicians only. 23. In teaching adult NICU learners about ventilator management, which technique maximizes knowledge retention? A. Problem-solving scenarios with hands-on adjustments. B. Reading aloud from ventilator manuals. C. Passive video watching without practice. D. Listening to an expert lecture without discussion. 24. Which mentoring strategy supports critical reflection after adverse neonatal outcomes? A. Structured debriefing sessions with open dialogue. B. Assigning blame to individuals publicly. C. Ignoring emotional impact to focus only on policy. Avoiding discussion of sensitive cases. 25. Which principle of adult education is reinforced by providing NICU staff with optional advanced learning tracks? A. Adults are motivated by relevance and personal goals. B. Adults prefer irrelevant, mandatory learning. C. Adults avoid autonomy in learning. D. Adults require uniformity in all learning experiences. 26. Which compliance strategy ensures adherence to HIPAA in neonatal nursing documentation? 8. Training with scenario-based confidentiality breaches. B. Reviewing policies only during annual orientation. C. Relying on peer observation without structure. Allowing staff to interpret privacy policies independently. 27. Which evaluation method best determines if NICU nurses can apply family-centered care principles? A. Direct observation during family interactions with rubric. B. Multiple choice test on theoretical knowledge only. C. Nurse's personal opinion about performance. D. Patient satisfaction surveys alone. 28. When developing a mentoring program, which structure enhances sustainability? A. Formal pairing of mentors and mentees with defined goals. B. Allowing ad hoc mentorship without guidelines. C. Avoiding program evaluation. D. Limiting mentorship to short-term orientation. 29. Which adult learning method best helps NICU nurses learn from high-stress scenarios? A. Simulation-based experiential learning. B. Lecture-only presentations. C. Reading policies silently. D. Unstructured peer conversations. 30. To evaluate curriculum effectiveness in neonatal medication safety, which approach is best? A. Pre- and post-tests combined with incident report analysis. B. Relying on attendance records. C. Collecting only anonymous feedback forms. D. Monitoring staff satisfaction without outcome data. 31. Which mentoring communication style builds trust with novice NICU staff? A. Active listening with constructive feedback. B. Dismissive criticism without context. C. Monopolizing conversations with personal stories. Providing vague reassurance without guidance. 32. Which regulatory compliance step is essential when implementing new NICU electronic health record documentation training? A. Aligning training with federal and state privacy standards. B. Prioritizing convenience over compliance. C. Excluding updates on data security requirements. D. Using outdated software for practice.